Thank you for joining us for the fourth annual Global Summit on Kidney Innovation, Global Kidney Patient Voice, the key to accelerating innovation, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. My name is Ed Hickey, and I am Vice President of the American Association of Kidney Patients and Chair of the AAKP Veterans Health Initiative. I'm a former Marine Infantry officer and am a practicing attorney in Los Angeles. I'm active in the Armed Forces legal community here in Los Angeles and have been work with the Veterans Legal Service Project of the LA County Bar Association, working to identify and address opportunities to assist veterans, active duty military personnel, and reservists with their legal needs. As a kidney patient and an experienced caregiver to those in my family who have also suffered from this condition, I am well aware of the need for innovation in the kidney care space. I've advocated on Capitol Hill on behalf of patients for innovations and worked with executive branch agencies to assess the efficacy of new methods for treating kidney disease. As an AAKP member, you can do the same. It is critical now that we as patient consumers raise our voices and create the demand for new diagnostics, devices, and biologics in our independent countries. Through AAKP Global, launched in 2019, AAKP is engaged internationally because we are committed to educating patients and leaders around the world on the importance of kidney disease prevention, innovations in treatment, and the opportunity to save more lives. We believe that a united patient voice can drive innovation and policy decisions that determine timely regulation and payment for new and safe care treatments. Globally, we are working with patients, medical professionals, researchers, and medical industry allies to cultivate a united consortium led by patients. AAKP believes this international consortium can advance innovation and change kidney care in countries where healthcare systems and/or infrastructure do not support patient consumer choice and/or access to care or treatments. For this session, titled Global Kidney Patient Voice, the key to accelerating innovation, government agencies prioritize global kidney health, United States. I would like to now introduce our next presenters who I've had the opportunity to work with as consumer reviewers for this program. Ms. Melissa Flathmann, Consumer Reviewer Administrator of Peer Review and Science Management for the U.S. Department of Defense, Congressionally Directed Medical Director Research Program, and her colleague, Ms. Ann Dodelin, Senior Consumer Reviewer Administrator of Peer Review and Science Management for the U.S. Department of Defense Congressionally Directed Medical Research Program. AAKP has had the honor of providing patient insights for the CDMR program for several years, and many of our boards and ambassadors, like myself, have served as consumer peer reviewers. Without further ado, I'd like to turn it over to Melissa and Ann to share what this program is and how patients as consumers can become involved.
Hello, I'm Ann Dodelin, along with my colleague Melissa Flathmann, and we represent General Dynamics Information Technology, or GDIT. We work with advocacy organizations and patient advocates like yourselves to identify individuals to serve alongside scientists and to review Department of Defense, DoD, biomedical research applications. Our advocates are called consumer reviewers, and they're valued for their lived experience with the condition, disease, or illness. For over 20 years, GDIT has supported the Congressionally Directed Medical Research Programs, CDMRP, and the DoD has contracted with over 4,000 individuals who has served as patient advocates or consumer reviewers at peer review. For this important work, today, we want you to hear how advocates can become involved in this important work to advance biomedical research, and we hope that after hearing this presentation, you will be excited to get involved and be nominated. Today's presentation has just a few objectives. First, We will provide background on the congressionally directed medical research programs and General Dynamics information technology. Then, we will define the patient advocate as the consumer reviewer and their important role and how they fit into the review of biomedical research applications. And finally, we will conclude with how to get involved and what's involved in the nomination process. CDMRP and patient advocates. The Office of the Congressionally Directed Medical Research Programs, CDMRP, is funded through the Department of Defense via an annual congressional legislation known as the Defense Appropriations Act. For most programs, the DoD sends a multi-year budget request to Congress in the form of the President's budget. Many of you are involved in lobbying on Capitol Hill to ensure that funding is included annually for your program or topic area. Once that annual congressional appropriation is approved, the CDMRP solicits applications from scientists around the world with the overall goal of funding high-impact, high-risk, high-gain projects that other agencies may not venture to fund. These research efforts focus on areas such as basic science, treatment and intervention, prevention, detection and diagnosis, epidemiological studies, and neurobiological genetics. Patient advocates involved. Who are patient advocates of peer review? As mentioned, one of the hallmarks of the CDMRP is the consumer patient advocate involvement in the peer review process. Consumer reviewers are patients, survivors, advocates, family members, and healthcare practitioners. They play a pivotal role in the future of biomedical research funding. In order to transform healthcare for the service members and the American public, the CDMRP looks to those who have the lived experience, those who understand the effects of a disease or an injury or a condition, and include them in the peer review process. By integrating consumers, patient advocates into the peer review process, they enrich and inform the scientist reviewers with personal perspectives, passion, and a sense of urgency that ensures the human dimension is incorporated in the research focus. In order to participate, consumer nominees must be nominated by an advocacy organization or agency. They must have direct lived experience with the topic, condition, or diseases directly related to the research focus area and exhibit accomplishments and commitment to education, treatment, and patient advocacy. Advocates are often engaged in a multitude of activities, and many of you may have participated in your organization's lobbying efforts. Serving as a peer reviewer may be the next natural step in one's advocacy setting, seeking firsthand how the lobbying efforts and their advocacy work impacts peer review. Here are some of the qualities that we're looking for in a prospective consumer reviewer at peer review. Involved in advocacy work, knowledgeable of the disease and condition, the ability to engage in discussions, speaking of the practical aspects of the research and the direct impact to patients and survivors. Comfortable in representing all consumers and their collective perspective during panel discussions, and interested in expanding their scientific knowledge. Consumer reviewer responsibilities. Let's talk about the work involved as a consumer patient advocate reviewer. The work will begin approximately 4 to 6 weeks before the actual peer review meeting. Most work is performed from the comfort of the participant's home using our proprietary web-based grants management review system. An internet access and a personal computer with a camera is required for this work. We do maintain strict deadlines that must be met throughout the process. Consumer patient advocate reviewers are required to participate in live orientations and view recorded trainings, read their assigned applications, and write a very brief, about 1 paragraph, critique or evaluation of the impact of each of their assigned applications. Guidance and support is provided throughout all phases of the review process with access to our knowledgeable staff at GDIT. The pre-meeting work culminates in the peer review meeting. Meetings are held in person or video conferencing. And however, at this time in 2022, all peer review meetings are being conducted virtually. Meetings are between 6 and 8 hours with breaks given, and the consumer is required to attend the entire peer review meeting. Consumer advocate reviewers are considered a consultant to GDIT and therefore receive an honorarium upon successful completion of their work. At this time, I will hand the presentation over to my colleague, Melissa.
Thanks, Anne. We have listed the CDMRP FY22 topic areas that align with those supported by AAKP, such as nephrotic syndrome, FSGS, PKD, heart disease, nutrition optimization, and more. Additionally, we want to remind you that kidney disease often has comorbidities, and those conditions are included in the CDMRP Peer Review Medical Research Program. We also have a kidney cancer research program. You can see here by the long list of topics that you were well posed to help CDMRP review these applications. We are glad to answer your questions about the CDMRP topic areas, and you can find a full list on the CDMRP website. You may be wondering about how to get involved with this opportunity to serve as a consumer reviewer. Individuals need to electronically submit our e-nomination form along with the current resume. The nominating organization will need to prepare a letter of nomination for the individual. This letter should speak to the nominee's knowledge of the condition or disease and their commitment to advocacy, and this should be on letterhead. The nominating letter can be sent directly to us electronically or provided to the nominee to include when they email their nomination form and their resume. A GDIT Consumer Review Administrator will review the submitted nomination forms and schedule a phone interview with the nominee. You will be updated on the status of nomination, and once approved, consumer reviewers are eligible to serve for up to 3 years and do not need to reapply. We would like to share some of the reasons individuals want to serve as a consumer reviewer. Follow the funding. Advocacy organizations and patient advocates are the ones who tirelessly work for funding each year. By participating as a consumer reviewer, you get to follow the funding. Serve as the voice for others. Consumer reviewers are provided a platform to share their lived experience and be the voice for the community. Consumer reviewers will represent all of the voices who don't have a seat at the panel, those who have been taken by or yet to be diagnosed, or who are not well enough to participate. Give back. Consumer reviewers who have benefited from research often want to be a part of future research. This is an opportunity to give back. Personal legacy. Many reviewers wish to serve as part of their personal legacy. They want to spend their remaining time making an impact by adding to their living legacy. Professional connections. Through participation, both professional and personal connections are made with fellow reviewers. The scientific reviewers are expert researchers and clinicians, and you'll be introduced to those on your panel. Participating in the peer review provides you with an opportunity for networking and expanding your group of professional connections. Expand scientific knowledge. Consumer reviewers have the opportunity to expand their scientific knowledge, learning what researchers are working on and what may be in the research pipeline. It's also an opportunity to learn about the research continuum. Providing hope. Most importantly, past consumers speak about how their participation provided them with hope, knowing that the contribution they make in the peer review process will in turn provide countless individuals, families, and communities with hope for improved prevention, early detection, better prognosis and treatment, and this provides great personal satisfaction. Kent is one of our experienced consumer reviewers who represents the National Kidney Foundation. You can read Kent's enthusiasm and support for serving as a CDMRP consumer reviewer and how the patient's voice can be heard through research. Now we hear from another consumer, Paul Conway. Paul also recommends getting involved as a consumer reviewer and touches on the impact patients can make. As you can see, both consumers speak to the importance of the CDMRP's hallmark of engaging patient advocates as consumer reviewers. We hope this sounds like something you'd be interested in pursuing. We want to work with you to ensure that you have a voice on our peer review panels and that your organization is represented and heard in this important research process. The peer review panels have started for FY22, and we are always looking to grow our pool of eligible consumer reviewers for now and for the future. Please contact Anne or myself with any questions, and we look forward to receiving your nominating materials. On behalf of CDMRP, GDIT, myself, and Anne, we would like to thank you for your time today and look forward to hearing from you.
Thank you both for a great presentation.